I'm Dr. Swati Naik and you're watching us on AICOG TV live from Bhubaneswar. I'm pleased to have with me Dr. Jenny Conry from California. Thanks a lot, ma'am, for coming here on AICOG TV. Dr. Jenny is a past president of American College of Obstetrics and Gynecology, and she's currently the president of Environmental Health Leadership Foundation. We are really pleased to have you here.
Thank you so much. Delighted to be here.
Thank you. We are going to have a conversation with Dr. Jenny on the very important topic of environmental health and infertility. So, ma'am, let me begin with the first question. How does environmental health actually affects the woman?
We know that it affects our health in a number of different ways depending on what type of exposure. There are a group of chemicals called endocrine disruptors that can impact immunology, neurodevelopment, reproductive health, a whole host of different things, our endocrine system. So those are chemicals that are found in the food we eat, the air we breathe, it's found in the chemicals in our skin products. So a number of different things are endocrine disruptors. So that's one way. The second way may be something like chemical exposures from lead in our drinking water.
Right.
That impacts our ability to conceive, increases stillbirth, and decreases fertility. The third way would be some of the pollution that we see. Air pollution. We know that air pollution is associated with increased risk of stillbirths and decreased risk, of birth weight in babies.
So, what are different measures that we can take to avoid environmental health? What's our role in such cases?
That's the most important question of all. As OBGYNs, I believe we are the experts in understanding this, and it really is a three-pronged approach. One, more research. We need to be able to tell people what research is there, what's good research, what's not. The second is education, just increasing awareness for OBGYNs and the lay public. And then the third is advocacy. We are the voice. And I use the phrase power of one, that we're the voice that's able to speak on behalf of our patients. We have the power as one individual to persuade people to understand how important environmental exposures are on health.
Nice to understand that, Dr. Jenny. But in that case, are you trying to refer that today we are our genes are getting affected by the environment rather than it's a pure genetic problem coming through the birth or chromosomal anomalies?
It is. If you just look at some of the graphs from the last 30 to 40 years, we can look at a whole host of disease processes, whether it's sperm counts. Over about a 40 to 50 year time period, sperm counts have decreased markedly. Hypospadias, a birth defect in the penile system, increased markedly. Breast cancer increased. Testicular cancer increased. So all of these have happened over 40 to 50 years, a time frame that's much too short for pure genetic change.
Absolutely.
So when you look at the complicated or complex genetics and environment, there are environmental factors influencing the outcomes.
Absolutely. So, ma'am, what are those different initiatives that EHLF has started in United States?
We're working very closely with the International Federation of Obstetricians and Gynecologists to bring the information all around the world, so that every country has experts and are able to find out what are the major issues in their country. For India, it would probably be air pollution and water pollution. If we talk about a country like Colombia in South America, they've identified mining and mercury from the mining as an issue. In the United States, it would probably be pesticides and personal care products. So each country has different issues.
Absolutely. So you are trying to have a connect between the different countries and try to map what all those different factors or the issues related to environmental health and affecting the health of the human being.
Exactly, and our goal would be to have advocates go to their ministers of health, speak with them as the experts in OBGYN, and let them understand why the issue is so critical.
Right. How has been your experience attending this AICOG 2018 conference in Bhubaneswar?
Absolutely wonderful. It's overwhelming in terms of the size, the sheer number of people here. Everybody has been so kind and delightful. The presidential initiatives, hearing the whole summary of what happened the last year by the president, and then the plans for the new president. Very impressive leaders in the country.
Thank you so much, ma'am. I'm sure that you will carry the beautiful memories from India and from AICOG 2018, and we wish you all the best for all those new initiatives and plans that you have as a CEO of Environmental Health Leadership Foundation. Thank you so much for joining us on MCure AICOG TV.
Thank
Thanks
you
a lot.
Thank you. Appreciate it.